This video will concentrate on how to task an abnormal result to the EMR clerk, or to save the fact that I've dealt with an urgent result. It'll deal with urgent versus non-urgent abnormal results, and also how to remember about certain nuances between our clinic environment versus our office environment. So for this reason, I'm simulating this video using my office environment, just so that you can see the difference. Let me log in. So as you can see, I'm logging in without the MC, and this is in the ASP.cloudworks.com. So I'm logging into my own office environment, because most of the time, I think most of us do review our office and our clinic results at the same time. So let me now choose our favorite patient, BCFHT Mindy. And let's also review one other thing. Most of you probably know how to do this, but let's assume that this was checked off. So I'm trying to find our patient, Mindy, and yet I know I've spelled her correctly, yet nothing comes up here. This is because this check mark will only search for patients within our own clinic, within our own office environment. So let's say that I now unclick this, and then this opens up the patient search to the whole database, and now all of a sudden you can see that BCFHT Mindy is visible. So let's choose Mindy. Now the results, abnormal results, have to be somehow logged in and shown that you've dealt with it, and usually the patient needs to be informed. So let's divide those into abnormal urgent versus abnormal non-urgent. So any abnormal urgent results, we have to remember that they have to be dealt with by ourselves, not the EMR clerk. So I'm in this case simulating that I've just seen a chest x-ray from a patient that I've seen a few days ago in the clinic, and it shows that she has a pneumonia. So I've just called the patient, and I have just faxed the prescription to her pharmacy. So I've done my my due diligence on that. Now I have to document into the chart that it is done for my own legal purposes. So that's why we've created this BFMC phone category. So now I can write down patient informed about abnormal chest x-ray, has pneumonia or a pneumonia, and then prescription was faxed to patient's pharmacy. So this protects me, and it allows any of the staff, especially the EMR clerk, to, if they need to check, to know that I've actually done that. I've reviewed the lab, and I've already contacted the person. Now let's keep in mind that, again, we're in the office environment. So as you can see on the bottom, there's one more step that you need to do. You can see that my name is not starred as it would be in the office, in the clinic environment. So if I were just to click OK on this, this will save just in my environment. So this will not be available to view for anybody in the clinic environment unless they change this to the faux providers. So in order for this to be a note clearly accessible by anybody at the clinic, I need to change this to my last name, so Lalik Star, and then that will show the system that I want this note to be saved in the clinic environment. So when I click OK, so I'm satisfied the urgent result is taken care of, and everybody knows that I've done that. Now let's look at the second scenario, where there is an abnormal result and the patient needs to be informed, but it's not an urgent result. So let's assume that this was some sort of a lab. Now in this patient, we don't really have any labs. So let's assume that this was let's say some sort of abnormality in CBC, and I want to task the EMR clerk that that was the case. So because again, this is a fake patient, I don't have any labs. Let's just assume that now I just want to task the clinic staff to call and inform the patient to follow up with her family physician or at the clinic to review a CBC. So first of all, when I click on the task, before I touch any other button, unless you want to fiddle around with this very long list of providers, if you just open a task, there are certain hotkeys. So don't touch any other keys. And then there's a hotkey for example, C for clinics, B for Barrie Community Family Health Team. So let's say the registered dietitian referrals, diabetic educators, etc. And then there's M for mental health. So because I want to task this to the EMR clerk, all I now have to do is click on C. And as you can see right away, without pulling this or touching this pull down menu, it brought everybody that's related to the clinic in view here in this window. Now if I were to just click on this tab, it highlights all of the EMR clerks, and then I can write down please have patient follow up to review CBC with her, if I can spell, with her family doctor or at clinic. And then unless this is priority, let's say this is more, let's say urgent, very urgent, I would just call the patient, but I can leave it as normal, or I have this ability here to, I use this mainly in my office environment. If I want my staff, if I click on very urgent, then they will see this instantaneously. It will pop up on their window. If it's normal or urgent, it'll just be visible there. Normal will be in black and urgent will be in red in their tasks menu or window. So let's say that I've done that and then I click OK, then this will inform the EMR clerk what I want to do with that abnormal test result. So again, if this is a quick tip also about tasking in general. If I were to task, and it's not somebody related to the office, but let's say I want to do a referral to the registered dietitian. I've done the general referral. Now I want to just task them that an appointment is required. I'm not touching any of the button. I'm touching the B button, and as you can see, it now brought up Barrie Community Family Health Team and then referrals, and I can just either put down some sort of information, call patient cell or whatever I want, or nothing, because this will now carry the referral. If I were to highlight the registered dietitian referral instead of this note, then that will be pinned to it, and just click OK, and that task is sent to the BCFHT. What else? So again, another hotkey, just as a quick reminder, would be if I'm doing the psychiatric referral, without pressing any other button, just M button will take us now to mental health. And I think that's it.